Many menopause symptoms can be reversed with a diet. If you suffer from menopause symptoms, this video is for you. In my previous video, I talked about how weight gain, dry mouth, anxiety, and bloating can be turned off by simple changes to the menu. Please click through to part 1 to learn specific diet techniques to fix these 4 menopause symptoms. Otherwise, stay tuned. Hi, I'm Dorothy Adamiak, former board-certified naturopathic doctor, author of 5 books, and the creator of Using Proportions Blueprints so you can finally get an A in health. Today, I dedicate this video to the 3 common menopause symptoms: joint pain, hair loss, and fatigue. These, just like the other 4, can be erased by making smart changes to the diet. Nothing fancy, no need for exotic foods or large grocery bills. Just adding few common foods to a menu or taking a few foods out can make a huge difference to your menopause symptoms. So let's go for it. Menopause symptom number 5, joint pain. A lot of women get joint pain during menopause, and that's a shame because joint pain, just like hair loss or fatigue, is linked to a lifestyle. Let's see whether exercise, HRT, or diet can bring relief. First, exercise. Apparently, joint pain and stiffness are less associated with menopause and more with physical activity. Let me rephrase that. Women who exercise have far less joint and muscle symptoms than those who don't, even if they are stuck in full-blown menopause. Do you exercise? Some doctors suggest hormone replacement therapy, but does it work for the joints? Apparently not that much. Although HRT may, but not always does, ease the joint pain modestly, it also significantly increases the joint swelling at the same time, so no. Diet, however, can help. Better diet can remove aches and pains as well as bonus other menopause symptoms. To significantly reduce muscle aches, you need to focus on 2 things: increasing antioxidants and removing oxalates. Which foods are loaded with antioxidants? Spices. Spices can dramatically reduce joint pain and stiffness. The best spices for joints are rosemary, turmeric, ginger, cinnamon, garlic, cayenne, black pepper, and cloves. Adding spices to your diet can also make a dramatic improvement to other menopause symptoms. For example, sage is great for night sweats, and ginger can eliminate stomach bloating. Adding spices to the diet is the simplest and the most natural way to deal with menopause symptoms. But do you know how to pair your spices with foods? No? Here are some great tasting pairs: potatoes with rosemary, carrots with ginger, and pineapple with cinnamon. For more awesome pairs and recipes, get yourself 69 pleasures. I promise your kitchen and your body will never be the same. What about oxalates? Oxalates can cause stiffness and calcification. I bet you don't suspect that a clean diet featuring sweet potato fries and spinach smoothies could possibly be responsible for your chronic back troubles, do you? Leafy greens, beets, almonds, chia seeds, soya, kiwi, and cocoa are high in oxalates. And oxalates can make joint pains as well as many other menopause symptoms significantly worse. To know if oxalates are in fact making your symptoms worse, you need to strike them off your diet and continue oxalate-free for a few months. More on oxalates and menopause symptoms is coming up in the future videos. Subscribe not to miss it. Menopause symptoms number 6, hair loss. There are 2 main reasons for hair loss and hair thinning during menopause: insulin resistance and nutrient deficiencies. Insulin resistance is the most common cause for hair loss in women. But to get rid of the insulin resistance, you have to get rid of the visceral fat first. What's the best diet to get rid of visceral fat? Low carb. Low carb is the best diet for stubborn belly fat that has roots in insulin resistance. If you need step-by-step instructions, please follow my Using Proportions blueprints. And they are designed to teach you the simplest yet the most effective lifestyle techniques to get innate health. If you're not sure whether insulin resistance is the cause behind your excessive weight, here's a cue. If you grew belly fat during menopause, chances are you have it. Test for it, deal with it, and don't let it ruin your hair. Now about nutrients. Does your diet have enough nutrients to feed your hair? If your hair is brittle, dull, and thin, your diet is lacking nutrients. Hair health is directly linked to a diet. And if your diet is poor in nutrients, your hair will reflect it. 5 of those nutrients, protein, iron, vitamin D, folate, and vitamin B12, are especially important to stop hair loss. Where do you find those nutrients? Here are 5 common foods that get the job done. For extra protein, make jello from beef gelatin. For vitamin D, eat scrambled eggs. For vitamin B12 and iron, grill beef burgers. And for folic acid, make a romaine lettuce salad. Add those foods to your diet and see what happens in a month or 2. Now, a few tips beyond the diet. Many prescription and over-the-counter medication cause nutrient deficiencies and can contribute to hair loss. Cholesterol-lowering medication and blood pressure medication are on the top of the list. If your hair is thinning, you may want to rethink the meds. Menopause symptom number 7, fatigue. Certainly, you may feel extra tired during menopause because fatigue is made worse by low hormones. But even though it looks like tiredness is a menopause symptom, you can lift it by making changes to lifestyle and diet. Chronic fatigue is a complex condition, but I can simplify it. Chronic fatigue needs combination of 2 factors: chronic injury and a lowered ability to heal. Does any one of these 2 apply to you? Let's see. Do you eat junk food, use chemical products, or take medication? If you do, you may be contributing to chronic fatigue without realizing it. For example, that pizza you usually order may be loaded with soybean oil, which adds to oxidative stress. The Tylenol you need for migraines may be depleting your body from an antioxidant glutathione. And that air freshener hanging in your car may be taxing your lungs and liver. Frequent mini insults and injuries can lead to chronic inflammation. And inflammation takes up a huge amount of available energy, which means there is less for you. If your body is chronically inflamed, your energy reserves are going to be drained. It's in your interest to end the inflammation as soon as possible. But if your body has nutritional deficiencies, this may be difficult. And that's why you need to ensure that your diet is full of nutrient-dense foods before, during, and after menopause. What foods should you aim for? Animal products, meats, organs, eggs, and dairy deliver a superior blend of nutrients so your body can deal with inflammation, fatigue, and other menopause symptoms. But maybe your doctor told you that your fatigue is due to low thyroid, not inflammation. I get that. But thyroid, just like any other organ, needs nutrients too. Did you know that many hypothyroid cases are not due to thyroid malfunction, but simply due to nutrient deficiencies? If your diet does not supply nutrients your thyroid relies on, it won't be working. Just like your car won't be working if you don't put fuel in. So pay attention to your diet and make sure it supports your thyroid. Your thyroid needs iodine, selenium, and zinc. A deficiency of either of these can lead to poor thyroid function and eventually to fatigue. Which foods are best sources for iodine, selenium, and zinc? Ocean fish for iodine, Brazil nuts for selenium, and beef for zinc. Add them to your diet. These foods may help your fatigue, thyroid, and may even have a few viruses go away. Viruses? Iodine, selenium, and zinc are also the key immune system nutrients. Good to know. Foods, nutrients, and diets. That's how you deal with menopause symptoms. Don't put up with bad menopause. Don't put up with nagging symptoms. Invest in good self-care, or better yet, get innate health. Get our Using Proportions blueprints and see you in the next video. Subscribe to keep in touch.